So thanks for that introduction. I am indeed a PhD student here at York in communication and culture. And as Evangeline said, my research interests are largely in the science communication area. And serendipitously, I got involved in this COVID-19 project studying the impact of COVID on the Chinese community. So I didn't exactly intend to go down this line of inquiry. I'm kind of glad I did because there's a lot of interesting stuff that I've learned along the way. Um, this is a research project led from Doctors Ida Mujay, Jack Rodzilski, and Charlotte Lee out of the Department of Emergency Management. And really, when they set out to do this work, they wanted to know what this impact of a location-based disease has on the diaspora of the people from that location, and what can disaster and emergency managers and public health officials do differently to lessen that impact on people from that community. So what we had done is we spoke to 83 self-identified Chinese Canadians in the GTA. The interview periods from March to July of last year. And really, it was a semi-structured interview. And really what we were trying to get at is what their experience was. And the questions were fairly open. So, what's in a name? And unfortunately, a lot. The memory of SARS loomed very, very large in this community, and I'll talk more about that. And even though the WHO, as early as 2015, had issued guidance on not using place names for new diseases, that was not really well put into practice. Zika was still called the Zika virus. And so before they actually settled on an official name for, what was it, 2 months plus, every newspaper had headlines like this, the Wuhan virus or the Chinese virus. And it was accompanied by images of masked Asians. And that sort of became the symbolism, the symbol of this virus. And I want to say that this symbolism had quite the impact on the community. So news travels fast. It was the eve of Chinese New Year, and phones in the diaspora buzzed with the news that Wuhan had been locked down long before our television sets did. What we discovered is that people had a lot of people had very strong links back to Asia, and those who did acted much more decisively, much quicker. They took the virus very seriously. They sprung into action. If you recall, a year ago, there were a lot of people on TV talking about how to combat anti-Asian racism. I gotta say, a lot of us in this community saw this coming. Did we foresee people being shot the way that they were in Georgia? Perhaps not, but we definitely saw this coming, that we were going to see a repeat of SARS. And for anybody that had lived through SARS, whether they were in Canada or in Asia, that memory, excuse me, that memory loomed really large. And I would say that was a single biggest factor in how the response was, their personal responses to this virus, I should say. So let's talk a little bit about that SARS effect. When people had brought up SARS, we didn't specifically ask about SARS, by the way. It came up organically in the interviews. And when people brought up SARS, and it was top of mind for many, the ones who were in Canada at the time, many of them said, yeah, I just saw SARS coming back. And they had memories of being bullied. They had memories of shuttered businesses. And they were very quick to go, we want to avoid the situation again. For those that spent SARS in Asia, they didn't have quite that same experience of people who spent it here. And for them, they were very, very quick to wear masks because that's what's been happening in Asia since SARS. They were quick to buy supplies, to stock up, to start social distancing. And we'll talk a little bit about that in a bit. Like, they were very, very fast on doing all these things that we've all come to accept as normal right now. And at the time when they were doing it, it was ridiculed. And that created quite a lot of tension. And I will talk a little bit more about that communication around that and how we can do better in the future. So SARS really had quite the impact on people and that memory of SARS. So, mixed messages. And pardon the pun, I thought it would be funny. So mixed messages about this. And you see the date on here, March 1, World Health Organization was basically still saying, don't use masks, don't mask up, don't do this. And it really created a sense of discomfort. In fact, I would call it hostility. And the one thing that really, really stuck out to me in these interviews were people saying things like, well, Terri, I know that wearing masks is the right thing to do. That's what we do in Asia. And the spread in Asia is not what it is here. And they said, for my own protection and for protecting others, I want to wear a mask. And so I prefer going to Asian grocery stores because everyone's wearing masks, and the Asian community, they put up their own policies long before public health did. Like, they had mask wearing policies, they had sanitizing policies. This happens so much faster than actual public health directives. And they were on the leading edge of this. They were pushing, they were petitioning for mask wearing. And at the same time they were doing this, public health officials were saying things like, unless you're sick, don't wear a mask. It doesn't help you if blah, blah, blah. And there was a lot of mixed messaging around masks. And what it created was this hostility. And people said, you know what? I'm just going to stick to Asian grocery stores and Asian spaces, because when I walk into a white space, and they might not have known that word, and they say at the Longos or the subway, I get these dirty looks and I feel really uncomfortable. So they would actually take off their mask when in these spaces. And it was against what they wanted to do. It was against their better judgment, but they felt this pressure to do it. And something I want to point out, and I could be preaching to the choir here, given who's in this room. I had one of my colleagues say, Terri, I don't get it. What's the big deal about a dirty look? So if I want to wear a mask and I walk into York, I'm wearing a mask, no big deal. So what, they want to give me a dirty look? And I had to explain that, if you came here young or you grew up here, a dirty look, and being Asian, of course, or any minority really, a dirty look to you is different from a dirty look to me, because when I get a dirty look, that could be preceded by a punch in the face. And for you, a white guy, that's not your experience. So you can ignore a dirty look. Whereas for me, there's a level of fear when I get a dirty look. And that's something that I realized working on this project that many people don't realize. And just something as subtle as a dirty look can have such a big impact. So the fear of the racist acts were very, very prevalent. And unfortunately, we did see that play out in Georgia. And we can talk a little bit more about that in a bit. So let's talk about the political response to this community. As I said, the community acted very, very quickly. There were petitions very quickly, advocacy for mask wearing, calls for social distancing. And the petitions were about, in some cases, school closures and flight bans. And these petitions, ironically, were started a lot by Asians in these communities. And what happened was um, sorry, oops, sorry, is what happened was that the community felt very, very ignored, because rather than taking seriously their concerns about the virus, about spread transmission, um, people say, well, let's not get racist. Let's support these businesses. And while we really appreciate the support, and certainly the business community, I think this is a broader problem about the capitalist system that we live in, really. But there was all this, these photo ops just like this, where, oh, we want to support these restaurants, and meanwhile ignoring the very real fears that many in the community had over transmission of this disease. And then what proceeded next was a sense of crying wolf, because these businesses, 90+% of their patrons were Chinese. And it's like they're not being racist. It's a genuine fear. And then what you started to see, especially on social media, is like, see, there's no racism. We don't have a racist problem. These are Asians not supporting their own businesses. This is not a racist problem. There is no racism. And that narrative is even worse. And the politicians, they meant well. We're sort of trapped in this system of this economic, infinite growth economic system, and it's not necessarily their fault. And there's a bigger picture here that I do want to point out of the issues and competing, both narratives and competing needs of this community. And I will say that there were a lot of people in our community that weren't really happy with the political response, because that knowledge sort of felt ignored. It's like, oh, you don't know what you're talking about. Mask wearing doesn't help. And they were quite upset by this, and people were quite upset by this, oh, we know better kind of attitude towards what the Asian community was doing. So, So some things that I do want to talk about is what can we learn from this community? This map is York region, and something I want to point out about this. So York region, they have this. Obviously, we're in the same country, so same federal laws apply to us all. Same provincial rules. And these are side-by-side municipalities that are actually in the same municipal, I don't know how you would call it, but the municipal community. Like, they have a York region governance. And so a lot of the rules that they're following are very, very similar. In fact, I would say pretty much the same. And two side-by-side communities here. On your left, the red one is Vaughan, and on the right is Markham. And there's obviously infections happening in both. And from all the obvious social economic indicators, Vaughan is slightly richer. I'm not sure, and I haven't found it, and perhaps this is something that will have to be looked into a little bit more. I'm not seeing a lot of obvious industries like there are in Brampton and in Peel that would lead necessarily to higher rates of infection in Vaughan. Housing density is actually lower than in Markham. Like I said, income is a little bit higher. So all the obvious indicators favor Vaughan. Yet Markham has a lower infection rate. Vaughan is actually 50% higher infection rate than Markham. And I look at this and I go, why is that? But Markham is almost 50%, 45%, I believe, Chinese, while Vaughan is 7% Chinese. And I do want to say that perhaps media, or the media that's being consumed, has something to do with it, that people are taking it more seriously. There's possibly a cultural element. And in our interviews, we did not find any anti-maskers. At the time when the government was saying, don't wear masks, certainly there are people who were not wearing masks. It's like, oh, we're just following the directive. And if that changes, then we'll do what people are saying. But there weren't anyone that was going, no, we're not going to wear masks, because the mask directive came in during our interview period. And even after that had changed, that guidance had changed, everybody started wearing masks at least that we had talked to. So what can be learned from this, particularly for public health officials? So what's in this? So the next phase of our research, we're about to start the 1-year interviews out. We're going to have a similar set of questions. We're going to talk to different people, and get their take on vaccines, what their lockdown experience has been, what their recovery needs are. And we really want to focus this on what can authorities like emergency managers and public health officials do differently to support these communities, and what can we learn from them, right? And that's basically it for me. So thank you very much for your time and attention.